Walking is often praised as the simplest way to keep your heart strong, but not everyone can rely on a daily walk. Joint pain, harsh weather, safety concerns, or limited mobility can turn a pleasant stroll into an impossible task. Top heart surgeons know this, and they routinely guide patients toward other effective habits that protect the cardiovascular system. Today, we begin a 3-part series explaining 5 surgeon-approved activities that boost heart and blood health when walking. Is not an option. In this first part, we will explore the science behind 2 of those activities, why they work, and how to start them safely at home. Activity 1. Paced breathing for vascular. Relaxation cardiac specialists frequently teach paced breathings, sometimes called resonance breathing, to patients recovering from surgery or managing hypertension. The method is straightforward. Sit upright with both feet on the floor. Inhale through the nose for 5 slow counts. Exhale through slightly pursed lips for 6 slow counts. Continue for 5 minutes. Why does this matter? Slow breathing stimulates the vagus nerve, lowering heart rate and blood pressure. Clinical trials at major hospitals show an average reduction of 6 to 8 systolic points after 2 weeks of twice-daily practice. Participants also report less anxiety and better sleep. To begin, set a timer for 2 minutes each morning and evening. Gradually extend the session to 5 minutes. If counting feels awkward, use a free phone app that plays gentle tones for inhale and exhale cues. Over time, paced breathing becomes automatic, offering a portable way to calm the cardiovascular system during stressful moments on the phone, in traffic, or while waiting for an appointment. Key points to remember. Keep the shoulders relaxed. Breathe from the diaphragm rather than the chest. Avoid holding the breath at the top or bottom of each cycle. Within 10 days, many people notice easier blood pressure readings and a calmer resting pulse. Activity 2. Seated resistance band circuit movement is critical for circulation because contracting muscles push blood back toward the heart, reducing strain on arterial walls. When walking is limited, resistance bands provide a safe alternative. Unlike free weights, bands offer gentle, adjustable tension and require minimal space. A basic 3 exercise routine takes about 6 minutes. Seated bicep curl, loop the band under both feet. Grasp ends, curl toward the shoulders for 12 repetitions. Seated row with the band still under the feet. Sit tall, pull elbows back while squeezing shoulder blades. 12 repetitions. Single leg press, keep the band under 1 foot. Hold ends near chest. Extend that leg forward against tension. 10 repetitions each leg. Perform the circuit 3 times per week. Heart rehabilitation programs report improved venous return, modest increases in good HDL cholesterol, and stronger leg muscles after 8 weeks. Beginners should choose a light band. Those with joint limitations can shorten the range of motion until strength improves. Safety tips: exhale during effort. Inhale during return. Keep movements slow and controlled to avoid jerking. Stop immediately if sharp pain occurs. Why these 2 habits work together? Low breathing reduces blood vessel tension, while band exercises enhance muscle-driven circulation. Surgeons often recommend breathing after resistance work to bring the heart rate down smoothly and train autonomic balance. The combined routine can be completed in 15 minutes, requires no special environment, and fits easily into mornings or evenings. Common questions: can these replace medication? No. Always follow your physician's plan. These activities support rather than replace professional treatment. How soon will I feel benefits? Breathing results often appear within 2 weeks. Strength gains usually show after 3 to 4 weeks. Are bands safe for people with arthritis? Yes, if you start with low tension and limited range. Warm up joints with gentle circles before starting. Getting started, purchase a light or medium band. Available at most pharmacies or online. Choose a quiet chair with good back support. Schedule 5 minutes of breathing and 6 minutes of band work on alternate days for the first week. Track blood pressure and energy levels in a small notebook to notice improvements. Consistency is more important than intensity. Even brief sessions practiced regularly can produce measurable cardiovascular gains. Looking ahead, in the next part of this series, we will introduce 2 additional recommended strategies that improve heart rhythm and blood flow without requiring traditional cardio workouts. Each is low-impact, evidence-based, and adaptable to individual limitations. Before you move on, please take a moment to like this video if you found the information useful. Share it with friends or family who may struggle with walking but still want a healthier heart. Subscribe so you don't miss the rest of the series. And add your experiences or questions in the comments section. We read every one. If you joined us for part 1, you learned that heart surgeons often recommend paced breathing and resistance band exercises for people who can't rely on daily walks to protect their cardiovascular health. Those 2 methods alone can lead to noticeable improvements in blood pressure, heart rhythm, and muscle tone. Now, in part 2, we'll go deeper into 2 more science-backed strategies that may surprise you. These next 2 habits don't require lifting weights, going outside, or even breaking a sweat. But their impact on your heart, blood flow, and longevity is just as real and often overlooked. Let's begin with the 3rd strategy. Strategy number 3, hydrotherapy, the heart-soothing power of warm water. Many seniors are unaware of how beneficial warm water therapy can be for the cardiovascular system. We're not talking about swimming laps or soaking for luxury, but rather a simple warm bath or foot soak with purpose. Studies from European heart clinics show that immersing the body, or even just the lower legs, in warm water can lead to temporary drops in blood pressure, improved peripheral circulation, and reduced heart rate variability. Here's why. When the skin senses warmth, blood vessels near the surface dilate. This reduces resistance in the arteries, allowing the heart to pump more efficiently. The result: lower workload on the heart and better oxygen delivery to tissues. In Japan, elderly patients with high blood pressure are often advised to take regular warm soaks. In a 12-week study, participants who took 30-minute warm baths 5 days a week showed significant improvement in arterial stiffness, an early sign of cardiovascular aging. You can apply this method at home. For a full bath, fill the tub with warm, not hot water, around 100 degrees Fahrenheit or 38 degrees Celsius. Soak for 15 to 20 minutes in the evening. For a foot soak, use a basin of warm water. Sit in a comfortable chair and soak your feet up to the ankles for 20 minutes. Some people add Epsom salts or a drop of lavender oil, but plain water is enough. The warmth itself triggers the vascular benefits. A few precautions: always check the water temperature before entering. If you feel dizzy or lightheaded, get out slowly and rest. Avoid bathing right after eating or taking medication that may lower blood pressure. Used consistently, warm water therapy can promote better circulation, especially in the lower limbs, which often suffer from reduced blood flow in older adults. Strategy number 4, isometric hand grip training. Here's something most people don't expect. You can lower your blood pressure just by squeezing. ISOMETRIC hand grip training is a method that's now recommended by several cardiologists, especially for seniors who need gentle but effective ways to strengthen the cardiovascular system. The process is simple. Sit in a chair with your feet flat. Hold a small rubber ball or hand grip device in one hand. Squeeze and hold at 30% of your maximum strength for 2 minutes. Rest for 1 minute. Then repeat, switch hands. Total time, around 12 minutes. What does it do? This kind of static muscular tension stimulates the arteries in the arms to become more responsive, improving elasticity and lowering resting blood pressure over time. In one Canadian study, Seniors who practiced this routine 3 times per week for 8 weeks saw a 10-point drop in systolic pressure on average. And you don't need a gym, a tennis ball, soft grip ring, or any resistance hand exerciser works. Best practices: breathe steadily throughout. Do not hold your breath. Begin with short holds and build up to 2 minutes. Gradually monitor blood pressure once per week to track progress. It's especially helpful for those with limited mobility, since you can do it while watching TV, reading, or sitting on the porch. Why these two methods work together while warm water therapy helps dilate blood vessels and reduce arterial pressure. Isometric grip training improves vessel responsiveness and blood delivery. Together, they help regulate both the vascular tone and pressure from 2 different directions, internal and external. Surgeons recommend both methods to patients recovering from surgery or managing hypertension without strenuous activity. If you've ever felt like gentle exercises were too easy to matter, think again. The body responds best to what it can sustain, not what exhausts it. Frequently asked questions: do these methods replace walking entirely? No. If you can walk safely, do it. But if pain, weather, or risk of falling prevents you, these are safe and effective alternatives. What if I have a pacemaker? Always ask your doctor before starting any new habit, but both warm soaks and isometric training are typically considered safe. Can I do both in one day? Yes. In fact, some surgeons recommend a warm bath followed by a short isometric session to optimize vascular benefits. Gentle routines. Lasting benefits. The secret to healthy aging isn't found in intensity. It's found in consistency and understanding your body's needs. These 2 heart-supporting strategies work with your system, not against it. In our final part, Part 3, we'll reveal the 5th habit, one that directly influences heart rhythm, stress response, and inflammation. It's often dismissed because it sounds too simple. But as you'll see, ignoring it may be the biggest mistake most seniors make. Stay tuned, and remember, this information is helping you or someone you love. Feel free to share it. The more people understand their options, the better they can manage their heart health on their own terms. Let's move forward together. If you've been following along, you already know that walking isn't the only way to maintain heart and blood vessel healthy, especially after 60 or 70. In parts 1 and 2, we explored 4 powerful low-impact strategies: deep breathing exercises, resistance, band workouts, warm water therapy, isometric hand grip training. Today, in part 3, we're going to look at the 5th and perhaps most underestimated habit: intentional stillness. That includes rest, mindful silence, and stress management, not just as emotional support, but as a tool for protecting your entire cardiovascular system. Let's begin. Strategy number 5, intentional stillness. Giving your heart the calm it deserves. Might surprise you, but some of the world's leading heart surgeons now encourage seniors to adopt a daily stillness ritual. Not for spiritual reasons, though that can help too, but because your heart functions best when your stress hormones are under control. And in older adults, chronic stress and inflammation are 2 of the biggest silent threats. When you're under constant stress, your brain signals your body to release cortisol and adrenaline. These hormones raise your blood pressure, narrow your arteries, and increase your risk of arrhythmias, irregular heartbeats. Over time, they damage the inner lining of your blood vessels and contribute to plaque buildup. That's why intentional stillness done regularly isn't a luxury. It's a form of medicine. What does stillness actually mean? Stillness doesn't mean doing nothing. It means setting aside a few minutes each day to slow your mind, lower your heart rate, and reset your nervous system. This can take many forms: sitting quietly and focusing on your breathing for 5 to 10 minutes, listening to gentle sounds with your eyes closed, journaling with a single goal in mind, to notice how you feel, practicing gratitude by mentally naming 3 things that went Well, today, these small acts activate the parasympathetic nervous system, your body's rest and digest mode. When this system is active, your heart rate slows down, blood vessels relax, and digestion improves. Even better, research shows that regular mindfulness-style routines reduce levels of C-reactive protein, a marker of systemic inflammation linked to heart disease. In one Harvard study, older adults who practice stillness or silent meditation for just 15 minutes a day over 8 weeks reduced their systolic blood pressure by an average of 7 UMCH. How to start a daily stillness habit? Simple. Pick a consistent time, ideally after waking up or before bed. Set a timer for 5 or 10 minutes. Sit upright in a quiet space. Close your eyes. Focus your attention on the feeling of your breath. Your mind will wander. That's okay. Just gently return to your breath, or repeat a calming word silently, like peace, calm, or breathe. If sitting isn't comfortable, lie flat, with a pillow under your knees, or place your hands over your chest and feel your heartbeat. The goal is to observe, not control. Over time, this routine can lower your resting heart rate, reduce nighttime cortisol spikes, and support healthier sleep. Bonus tip: combine stillness with nature if you're able. Spend your stillness time near a window or outside on a porch or balcony. Natural light and greenery help reinforce your circadian rhythm and improve serotonin levels, both of which benefit cardiovascular and mental health. You don't have to go for a hike. Just being near natural light and air, while sitting quietly, can enhance the heart protective effects. Recap of all 5 heart protective alternatives to walking. Let's briefly review what we've learned. Deep breathing exercises regulate heart rate, reduce anxiety, and improve OXYGNATION. Resistance band strength work. Boost blood flow and prevent muscle atrophy. Warm water therapy, dilate arteries, and improve circulation, especially in the legs. Isomeat hand grip training. Lower blood pressure through static muscle work. Intentional stillness reduce cortisol, inflammation, and heart strain. Each of these 5 tools is backed by research, and none of them requires intense physical effort. That's especially important for seniors managing mobility limitations, arthritis, fatigue, or cardiac conditions. Final thoughts: your heart doesn't need more stress as we age. The goal isn't to push harder, it's to work smarter. Every heartbeat counts. Every moment of calm, every breath, every healthy habit adds up. The heart is not just a pump, it's responsive, sensitive, and highly influenced by your lifestyle. And while walking is a wonderful practice, it's not the only one. There are safer, more accessible options for everyone, no matter your age or ability. So if you or someone you love has been feeling guilty for not exercising enough, let that go. Start small. Choose one habit from this series and practice it for the next 7 days. Even 5 minutes a day can begin to shift how your heart feels, how your blood moves, and how steady you remain as the years go on. And if you found this series useful, consider sharing it with a family member, a neighbor, or anyone who might benefit from a more gentle, heart-wise approach to staying healthy. Thank you for joining us. Take care of your heart. It's been taking care of you for a long time.